Hi everyone. Irma back again. Sorry it's been a couple of weeks since I've done a video. I've just been really busy just applying for jobs and getting ready for the holidays and helping out my parents with their doctor's appointments and whatnot. Also, I've also been trying to I had to reapply to the Board of Nursing and pay Pearson VUE again to get ready for my NCLEX. And yesterday was a busy day. I had to go to the university, my old university where I just graduated from, and I had to get a transcript in order to apply for one of the graduate programs, nurse programs that is going to be opening up that needed my transcript. So that took a while at the university just because there were some issues. As always, you plan to go in and out and you stay for like 45 minutes. So I had to do that and then just other family things. But when I got home, I saw that I got an email from that I have my authorization to test. So I jumped right on to Pearson VUE and I registered to take my NCLEX and I gave myself another this time I gave myself about I have to wait till after December to December 1st to take the NCLEX because it's a minimum of 45 days for us. Well, it was for me here in Texas. I know my friend when she took her NCLEX again, she couldn't take it for 2 months, and then mine was a month. I don't know. It's weird. So I don't know if it's like because our town. I live in South Texas, and it's not a small town, but it's not a huge town. It's just a good size city. And all of December was mostly full, except for like the day before Christmas Eve and like the end of December. And I didn't want to wait till the end of December or before Christmas Eve. So I kind of took it, I think it's the second week. I'm not too sure the date, but I set it for the second week, so that gives me about a little bit less than a month to study. In this video, I want to show you what I'm going to use to study this time around for my second attempt for the NCLEX-RN. And, um, yeah. So let me just tell you, it's not a lot. If you saw my other video talking about what I used, the first time I took NCLEX was I used Kaplan, and then my spelling what I used Kaplan and my yellow book, the Saunders yellow book. That's what I used. And this time I'm gonna try Hearst because I've heard many successful things and good things about Hearst. And I know, like I said, Kaplan is mostly geared to your test taking strategies, and Hearst is more towards content based. The reviews are content based, core subjects, med surg, all the subcategories like psych, maternity, pediatrics. And I think after taking the NCLEX and getting my analysis back, which wasn't really an analysis, I think my test taking strategies are okay. I think I'm okay with that. I just need to polish up on my core content. So hopefully Hearst will help me do that. And I actually printed the study guide on Hearst. So it's like 200 something pages. And I printed it all out in this wonderful book. So you can see I just printed all the pages out. And they come in these cool, like, first you do it by worksheets. So as you're like I started, so we did fluid and electrolytes. So here is the first page. It's fluid volume access hypervolemia. And all the red is what I filled in during the audio lectures. And you just fill in the blanks and you keep going. So it's split up into days. You don't do everything all at once, of course. You go crazy. So what I plan to do is each day after we finish all the sections, I'm going to, of course, listen, fill in, take notes while I do that. And then after I do that, I plan on doing about 120 questions a day pertaining to what I learned, right? So fluid electrolytes, burns, acid base, and a little bit of oncology. And my friend who took NCLEX told me about this app on your phone, and I bought it, and it's called NCLEX. Let's see. NCLEX Bank. I'm gonna try to put my phone in. My pictures of me and my husband, so I'll try to cover that. It's called NCLEX Bank. This one right on the far right. So I think you pay like $2.99, but you get a lot of questions. So then when you get into it, it says end exams. Try to get the glare out. There. I kind of see it that way, but it says exams. And you click on exams, and it has practice exam. It has everything from management and leadership all the way to child health. And it's not like just 20 or 50 questions. You get like a lot. Like management and delegation had 375. There's 393 alternative type questions, which really you need to practice those before you head to NCLEX. About critical care, pharmacology, fundamentals, adult health, maternity, mental health. So I'll kind of see all that. I'll try to do closer. I don't know if you can kind of see, but there's a glare. But that's all the subjects, and then there's a lot of questions. So I plan to do like 100, what did I say, 120, 110, somewhere like that a day after I do this. And then for meds, because I do feel that I need to brush up on my meds. And if you didn't see, I have a pharmacology for nursing students, and that is what I use to help me through nursing school, and also what I plan to use a little bit of those books for the NCLEX. But I also found this book in my shelf, in my closet of nursing, my nursing shelf. And I think I have this book for pharmacology when I took it before I even got into the nursing program. And it's Pharmacology Reviews and Rationale. And these books were lifesavers through every course during nursing school. And if you want a video about these books, I can do another one. I have like all of them for each course except for peds, because I lent it to a fellow nursing student like 2 semesters ago and never gave back to me. So, well, there's a gift for you. But that was a pediatric one. So I have them for mostly all the subjects except, well, I have like 2 or 3 of these. But these are really helpful when you're studying. So like the other books that I mentioned in the pharmacology video I did, this one goes by classes. So I'll just show you the first pages, the content page, and it just goes like that. So you have anti-infective, blood modifying, cardiac, endocrine, GI, immune, integumentary, and so on and so on. So it goes by class, a med class, because there's no way you can learn every medication known. You know what I mean? So I plan to just read over this daily. Like say I'm doing the GI in my first, then I'll do the GI meds, just do everything together in order, because that kind of helped me in nursing school. So I mean, I'm just gonna bring that out of nursing school and studying it for the NCLEX. So that's what I plan to do. I'm gonna just stick to these 2 things and hope for the best. So I have about less than a month, like I said, to study. I don't plan on studying all day because I don't really see the point in overusing your brain. So I'm gonna do my HERST, my questions, and my pharmacology. All the core areas I needed. I also took notes here on what other areas I kind of remembered from taking the NCLEX the first time that I needed to brush up on, and that's like infection control, like all the precautions, I need to brush up on that, and also priority questions, because there was a ton of priority questions. And not just in med-surg, it was like, it took priority questions, but it brought peds in, it brought OB in, it brought psych patients, like everything, you know? And then dosage cal, because there was that one darn dosage cal that really pissed me off. Because, okay, all through nursing school and through my exit has these, like, I was fine with dosage cal. I didn't have a problem. And the one I get on the NCLEX is the one that I have the toughest time with, and I'm like, really? Can you give me a drop factor? You couldn't give me none of those? No, a burn? You know, burn fluid resuscitation? Anything? No. Yeah. So that is my quick video. I know I'm in camo. I'm going to a camo birthday party for one of my little cousins. So yeah, so I have to borrow my husband's camo, which kind of fits me, but yeah, it's a little big and a little loose, but it's okay. And it is cold here in South Texas right now. I am freezing. Like it's been cold this past week. And for cold for us right now, it is my throat's kind of hurting actually. It is 52, 52 in Corpus. I'm not used to that. I was like freezing when it hit like 60. And then the other days it was like 40 something. Oh my god. Yeah, I busted out my boots and everything. And I got Starbucks. But yeah. So I'm feeling like the holidays and I want to hurry up and get this done and pass and get a job and yeah, just practice nursing because it's kind of taking longer than I expected and getting a job is a little bit harder than I expected. I've been applying. I had an interview for the other job, which didn't work out, but it's okay. Does anybody know about our GN permits if we don't pass NCLEX? I know because I went online and my GN permit is off the Board of Nursing. So if I get a job, I can't practice because I haven't passed the NCLEX, right? Like that's the question I have. Because I've asked around, some of my friends didn't know because they passed NCLEX, so they're just like, they're working and doing other stuff. But that's just a question. If anybody knows that answer, let me know down in the comments. And if you have any other questions or, oh, you like my wall? It's like 2 different colors. Yeah, my husband chose that color. Yeah. So, that is all for today, guys. I will talk to y'all later. Have a great day. Be safe. Be warm. Unless you're in Florida. It's like 82 in Florida or something, right? Yeah, I miss those weather. Not really, because it gets like really hot here, like over the hundreds, and then it's humid. Yeah. So that's all, guys. Have a great day. I'll talk to you later. Bye.